Hello again, everyone. Welcome to another edition of Odyssey House Journals. I'm Randall Carlisle, along with my co-host, Rachel Santizo. Welcome.
Hello. Thank you.
It's early in the morning, so we're
Very
both
early.
fresh and ready to go.
Yes.
We're doing something. This is a podcast dealing with addiction and recovery, and we're doing something a little different, both format-wise and topic-wise, than we normally do. May is Mental Health Awareness Month. And whenever you watch this, you may watch it in June or September, but it's always Mental Health Awareness. But May is officially Mental Health Awareness Month. And our two guests are on Zoom today. We have Rachel Devine, who is the Workforce Development Specialist with the Primary Care and Rural Health Office at Utah's Department of Health and Human Services.
Well said.
And obviously I had to write that down because that's a long title. Welcome, Rachel.
Thank you.
It's good to have you here. And our other guest, who we can't see today, is Dr. Rene Valles, who is a psychiatrist at Davis Behavioral Health. And he works with acutely suicidal, I'm reading here, so it's not I'm not brilliant, okay?
You're doing great.
With acutely suicidal children and adults and arranges crucial community support for his patients. And one of the reasons we have him here is because he is the recipient of something we're going to be talking about. So getting into this, think about, usually we talk to people who are in recovery, how they got, why they wanted to seek recovery, what their life was like before. And think about this for a minute. If you were, and you and I are both in recovery,
Yes.
if we wanted help and we couldn't get it, where would we be today?
Dead. Most
Dead
likely.
or in
prison.
jail or
Yeah.
something like that.
Yeah.
And one of the problems that we haven't ever talked about on our podcasts is getting qualified people to work at treatment centers.
Right.
You know, Odyssey House, it's a problem nationwide and certainly here in Utah. And trying to persuade people to enter this profession, because if you don't have people working with people in recovery,
Then there is no recovery.
there is no recovery, right?
Right, exactly.
And so, Rachel, maybe you could describe what you guys are working on and what the need is. Did I describe that okay? If there aren't workers, what are you going to do? You know.
That's great. Yeah, absolutely. Well, to describe the need, nearly all UTAHNS live in an area where there is a health professional shortage. So what that means is that there are just not enough behavioral health providers to meet the needs of that population. And so what we're working to do is create incentives for medical providers, behavioral health providers, dental providers, to meet those needs, to go to those populations. So we look at underserved areas, we look at rural communities throughout Utah, and we provide assistance with paying back student loans. So if you're going into school for a behavioral health specialty, if you're looking at becoming a therapist, there are options to get those loans paid back, and in doing so also serve the communities that have the highest needs.
And you talked about 3 million people. I mean, that's almost our entire state. You know, where are the areas? Is it rural areas primarily that are so underserved?
It's pretty significant in rural communities throughout Utah. It's also significant right here in Salt Lake City. It really, you can look at it from, the perspective of geography. If you live in an area where it's just really far to get to the nearest clinic or see a therapist. You can also look at, providers that are able to meet your needs as an individual. So if you have a language barrier, it can be really challenging to find someone who can provide culturally competent care.
And Dr. Valles, he does so much good work at Davis Behavioral Health, and the reason we wanted to talk to you, Dr. Valles, is because you were a recipient of a primary care and rural health loan repayment program grant. How did that work for you?
That's working pretty well. I graduated medical school in 2002. So since then, I've been looking for programs that would help me pay off my debt. On the average, a medical student has about 200 to 300,000 in student debt.
Whoa.
Yeah, that's a lot.
Yeah, it makes for a pretty healthy down payment on a home. But that's just the reality, and unfortunately, a lot of times it's the finances, it's the economic piece that influences people's decisions to do A, B, or C. And I knew that before I started medical school, and it says this on the very first line of my medical school application, that I wanted to serve the underserved community. And underserved means different things to different people, but underserved could be economic, it could be cultural, it could be gender, it could be a lot of different ways. And in my in my view, what I wanted to do is serve the underserved Latino population. I'm bicultural, I'm bilingual, and that was the population I wanted to serve. So with that said, I wanted to find the best fit for what my goals were in deciding a career, and after choosing to get involved in mental health, I chose to work in the community mental health field.
And I think if we're honest, choosing that field with a debt load that you were facing, the career you've chosen does not pay as well as, say, a specialist doctor, say, almost any specialty. I mean, our field of mental health, the salaries are not the same as they are for other doctors. Correct?
Yeah, that's exactly right. Unless you're removing something from the body or repairing it, the reimbursement's not very good. We kind of have a joke in medicine that insurance they really don't pay for people to think, they pay for more people to do.
Yeah.
That's a pretty good. That's a pretty good saying. So you're looking at a massive debt. You're looking at a profession that doesn't pay as well as some of the other people who have gone through medical school and have the same kind of debt you have. So how does this program specifically work for you?
Yeah, so this program, so I've been paying off my debt ever since I graduated from medical school in 2002. So it's been for a while, and as I mentioned before, I've been looking for different programs to try to help facilitate this loan repayment, and also what's even more important is something that would allow me to work in the capacity that I wanted to work, such as being a community mental health professional. So with this program, it's slowly paying off. It's helping me paying off some of the debt that I still have. I thought I would still be in my 70s before I finally finished off paying medical school loans. So this is going to allow me to pay that off just a little bit sooner than that, which is nice, because I think it's probably important to pay off loans before people retire.
Yeah, applying your Social Security to the loan you had from when you're in your 20s. Jeez.
I have a question for Rachel. What is behavioral health? What all does it encompass? If somebody's going to school and interested, can you describe exactly what that encompasses?
Yeah, so we offer financial assistance and paying back student loans for a wide range of behavioral health providers. We even include peer support specialists. So peer support specialists can get a small award of $750 to help pay back their student loans. or if they had to take out a loan in order to become certified as a peer support specialist. That's really what that is for, is to balance that out. We look at therapists, CSWs, LCSWs, psychiatrists, really a wide range of individuals who can work in the field. And we actually really have the legislature to thank for that. So back in 2021, they issued a $2 million investment in loan repayment for behavioral health providers. And when you think about it, I mean, we were in the middle of COVID. I think that more people than ever were experiencing mental health challenges, having mental illness come to the forefront because of the loss of control that came with the pandemic and the grief that came with it as well. And so that influx of funding has been a huge support. We've had a big jump in people participating in these loan repayment programs in the mental health field, which I'm really grateful to see.
Well, Odyssey House is grateful as well. We point out those benefits too as we try to attract people to work in our program, and we're not alone. I mean, every behavioral health provider is letting people know that these programs exist, so that we can fill. We all have so many open positions still.
Yeah, absolutely. I think that there is still a very high need, which is why it's so important that we continue to incentivize those opportunities and make it so that, it makes sense for people to pursue that career path.
Dr. Valles, I don't think when people think of behavioral health treatment, they don't think about the fact that you need a staff there for the program to work. I mean, that's so critical. A well-trained staff, yet there's a shortage everywhere.
Yes, I agree. Mental health's unique because there's so many players in mental health. It's just not the nurses, the doctors, the therapists. There's a lot of people in between that are just as vital to the management of folks. Caseworkers are huge. They do the heavy lifting. There's so many players. I just can't think offhand, just to name all of them. But anyways, it's a really multifactorial type of treatment that mental health provides. So the nice thing about mental health is that we're able to all work together and work in the best interest for the folks. So you have people navigating not only the medication side, such as myself, but you have people navigating the vocational rehabilitation, the housing, and other financial services, and then the therapy piece, and if we're talking about young kids, there's also that huge academic piece that's just as important as well. So you have a bunch of different players that are working together, and it's important to have very competent and compassionate individuals that are just as passionate as the next to work with these individuals, and that's what these programs do, is that they keep these individuals in the game to be able to provide the best care that we can. The private sector, they offer definitely more compensation, but with these loans, these loan repayment programs, it kind of helps level the field to where it really keeps these individuals doing what they really want to do and have always had passion to do.
On that note, from both of your perspectives, what is the importance of this topic to the community and yourselves? Why are you here today, and why are you advocating for it?
Well, for me, I'm here because I care so much about the mental health of our communities, and I've seen so much suffering. I think that the stigma is real. I think that a lot of people wait a very long time to seek mental health care. And then imagine that you've taken the steps to where you're interested in receiving the care that you so desperately need, and then it takes months to get a session with a medical provider, with a behavioral health specialist. That's really disheartening. And so I'm here because I really want to make sure that we're doing everything we can to ease that burden, to make it easier for people to step into the medical field, to step into the behavioral health field, and to really heal our populations and give them the support that they need to care for their families, to take care of themselves, to thrive. That's such a big part of it. And I think that for, anyone who's listening, I know that your podcast attracts a lot of people who are peer support specialists, who are, in recovery. And if anyone is looking for those options to go back to school, to take what they've learned from recovery, and apply it in a meaningful way as a career, that lived experience is incredibly valuable. And there's support on the back end after coming out of school to give back to those same communities that help support you, and reward you for that.
Oh, thank you. And I love your name too, Rachel.
Rachel and Rachel.
Yeah.
Dr. Valles, do you have some thoughts on what Rachel asked?
Yeah, I do. And my message is, do what you enjoy, do what you have passion for, because in the long term, it's going to make you feel the most fulfilled, and it's going to really prevent burnout. There's a lot of individuals out there that are doing things for different reasons, and it may not be the best fit for them. And after a while, they burn out. They're not happy. I'll tell you right now, every morning I wake up really, really excited to go to work and to work with the Davis community, the Davis County community, and I love serving, and I love being there for them. And another message that I have is there is help on the way. Thank you to all the legislators. Thank you to Davis Behavioral Health for allowing me this opportunity to sit where I'm sitting and be here, and to be available. But there is help on the way. So if you do decide on a career that may not reimburse you the way that other careers may, there is help on the way to help with loan repayment. And hopefully this is just the tip of the iceberg, because there's so much need out there, and the community ultimately benefits. It benefits in functionality, and it functions much better in that capacity with all these services available.
Of course, the problem is that all of us consider careers that interest us and that we want to do, but we also consider the fact that we have to pay bills, which and it's sort of difficult, because really the mental health field, as you said, Dr. Valles, it doesn't pay the same as many other professions pay, which I think is outrageous, because if there's so much focus right now on mental health, teen suicide ideation and drugs, and I mean it's a huge problem for society, and I agree that it's good the legislature has put some money towards this, but I don't think we've gotten far enough to make working in the mental health field attractive to people. Thoughts?
I agree. I agree, and especially with that said, unfortunately we went through a pandemic, and the numbers are gonna be through the roof. So we're just barely starting to see some of the ramifications of COVID and those 2+ years of isolation, social isolation, and developmentally we're all behind more than 2 years. So we're starting to see the numbers going up, and for those of us that are in the trenches, our social workers, our peer support specialists, our nurses, our physicians. I mean, we're starting to see these numbers creeping up, and the more help that we can get, the better off the community will be.
Especially in the long run, yeah.
You brought up a good point about burnout. So I would love to know, what do you do to prevent burnout? Because it's huge in our profession. And so just a little positive advice.
Well, community mental health it really gives so much back to me. Every day I count my blessings. Every day I look at what I have rather than what I don't, just by working with the individuals that I work with. Unfortunately, not everybody has a fair hand, if you will. There's a lot of barriers, economic barriers, cultural barriers. I get families coming in, grandparents bringing in their grandchildren, and foster parents bringing in kids, and adults that were raised in single parent homes, or with state support, or so we get a lot of different circumstances here. So working with these individuals really reminds me what I'm most grateful for. And these individuals and their stories keep me grounded and very, very thankful. And that really, really fuels my passion for what I do. And just knowing just how lucky I am just to be able to serve in this capacity.
Well, we're thankful to have you serving in that capacity.
Right.
We want to get into some nuts and bolts. So, Rachel, can you tell us how? I mean, you have these programs. How do people connect to the program? Because you brought up something really, really good that hits home for us at Odyssey is, and you've experienced this too, Rachel, is people who go through recovery and are happy that they're in recovery, want to give back and do things like become a peer support specialist. So how do people follow up on this?
Yeah, absolutely. Thanks for asking that, Randall. So you can go to our website, ruralhealth.health.utah.gov, and you'll find our programs listed there. So we have several different loan repayment options. I highly recommend checking out the Healthcare Workforce Financial Assistance Program. That's the program that really appeals to the widest variety of mental health therapists and specialists. We also have the National Health Service Corps, which is a federal program. They also facilitate loan repayment for LCSWs and other health specialists. If you're just coming out of school and you're not quite sure where to start, we also have a list of clinics and hospitals and organizations that have been longtime participants in these loan repayment programs and support their employees receiving these benefits. So I definitely recommend that, talking to your employer to see if they would be willing to participate if they haven't already signed up. There's a great resource called 3RNet that can give you some ideas about the jobs that are already out there. Employers can post on 3RNet, and it's really geared towards rural retention of medical providers and behavioral health providers. So those are some great ways to start out. So again, that's ruralhealth.health.utah.gov.
We and we're one of the employers. Odyssey Houses have signed up for the programs, and our HR department regularly sends out emails to the staff, talking about it. And I don't know how many people have participated, but but it seems to our need to hire people it's still great, but it's not as great as it was, say, a year ago. So so it must be working.
Yeah, it definitely helps a lot of providers just have that, and a lot of clinics and hospitals and sites have that added incentive that brings people in not only from, local colleges, but also from out of state. I've had many people call me and they're out of state and they're looking at these opportunities in Utah, wondering about who is accepting positions. So yeah, it does help quite a bit.
Yeah, we love people from all over coming to our state to help us, right?
Yeah.
Yeah. I really appreciate what you're doing, and I think it does make a difference, and it shows, like you work for the Department of Health and Human Services, and it shows that you're forward thinking. That you're not just thinking about right now, you're thinking about the future too.
Yeah, I mean, some of our innovations are surrounding around empathy and innovation, those kinds of things. And so I really try and integrate those concepts into the way that I'm thinking about administering these programs and making recommendations for improving them. Um, I also wanted to share, we have some great resources on our blog right now. So if you're looking for tips, so employers can support their employee mental health by using some key tips that we've posted on our blog. So creating a culture of care, getting involved in the community and utilizing resources. One of the great things about Mental Health Awareness Month is there's a lot of organizations that put on a lot of events just to put these kinds of ideas at the forefront of people's minds. DHHS, the System of Care Office, is actually holding a couple of walks on May 20th. So that's at Salt Lake as well as in North Price, and it's a walk to support teen mental health. So that's a great option to just learn more about local resources for mental health teens. I also just want to mention that if anyone is looking for options for substance abuse or mental health, there's the Office of Substance Use and Mental Health that provides a lot of different types of resources. And again, these are all listed on our blog as resources for Mental Health Awareness Month.
And Dr. Valles, what kind of message would you like to get out to the general public for Mental Health Awareness Month?
Yeah, good question. So a lot of us, struggle with mental health issues, and it's estimated that 1 in 5 adults do have and live with a mental health issue, and it comes down to functional impairment. If you feel like you're functionally impaired by your mental health issues, whether it's depression, anxiety, sleep, substance abuse, ADHD, ADD, whatever's going on, don't be too proud to reach out for help, ask for help. It's important that you take care of yourself before you can take care of other people. And I'm speaking more to, moms and dads and caregivers out there, grandparents, foster parents, and all those individuals out there. It's important that we really, take care of ourselves. That way we can take care of others. And so, please reach out, ask for help, and don't be too proud, and let pride get in that way.
A lot of people, which makes sense what you said, but let's say I have identified that I have one of the issues you just mentioned and I want to reach out. How do I reach out? I hear a lot of people expressing frustration. I don't know where to go.
Yeah, so there's several websites. The Huntsman Mental Health Institute. They offer wonderful care, and they have a lot of links on their websites for where to go and what's available. And that would be a good place to start. But maybe Rachel, I don't know, maybe you have other links as well.
Yeah,
for outreach.
absolutely. I highly recommend just doing a quick Google search for peer support specialists in your area. Oftentimes they have a really good beat on options, as well as identifying what your challenges might be and how you can find resources. It can also be really challenging to take those steps to find the provider that's right for you, and they can really help support you through that and keep it moving, especially if you're encountering depression or executive dysfunction. Just really finding an ally to help you can help reach that point of actually scheduling with a therapist, getting in, seeing if it's a good fit. It might be that the first therapist that you go and see isn't right for you, right? Like, you want to find someone that you can really connect with. And so I think that taking those steps to have an ally to support you in finding the right fit can be really helpful. I'd say that there's a lot of different organizations that specialize in that. NAMI Utah is a great one. They have offices all throughout the state that can help support you. I'd say that Connect Summit County up in Summit County has peer support specialists. Latino Behavioral Health Services has a really robust peer support specialist group. And so they can be a really good doorway to connect you with what is going to be most helpful.
We are out of time. So we want to thank, see, 30 minutes passes quickly, doesn't it? So we want to
It
thank
does.
Rachel Devine and Dr. Rene Valles for joining us today during Mental Health Awareness Month.
I know.
With some good tips.
That was great. So thank you for that. I also want to mention 988 as a resource.
Sure.
Yeah.
If you have any thoughts of
Crises
suicide
or
or anything
anything,
like
yeah.
that. So, and you know, our whole point is if you want to get into the profession, please do, because
Right.
we need you. And if you're not there in the profession to serve people who have identified they have issues that want to deal with, then nobody's accomplishing anything. So it's
right.
really important. So we're glad you watched and listened to another edition of Odyssey House Journals.